Buddy, hello. How are y'all doing? Oh, alright, project we kind of got going on is simply put, reconciliation training. Every company in Canada and the US says something about reconciliation and what they're going to do for our people, but we don't really see much action actually put into it. So our idea is kind of trying to implement that into the training and everything that's involved with the mental health services and the services that they're offering to us, including the other people that are around us. Would you take it away?
Okay, so as Zach said, the name of our project would be called Reconciliation Training. This prototype would connect with the theme of service coordination and system navigation by encouraging coordination of care practices specific to Indigenous people within Western care systems. So the collective vision for this prototype would be to train healthcare and mental health specialists in how to appropriately provide services to Indigenous youth and adults. We know that there are so many situations where young Native kids are brought into the system. They're either through medication, from foster care. There is no real, mitigation and advocacy for them in these situations. And we want to bring that to the forefront. So who is your prototype aim to serve? How many people will be impacted? Ideally, it is meant to serve Indigenous communities, Indigenous children coming into the mental health care system, even Indigenous adults as well. And it will also impact social workers, healthcare practices, healthcare providers, anybody who is going to be interacting with each other in these situations. How is your prototype innovative? How is it an original and creative approach? So we aim to bring back the original methodology of cultural recognition. How we would do this is, bringing that blanket ceremony to teach the cultural history of, how our people came together and the trauma that came with that. And where, a lot of our issues stem from, and what brings us into the mental care system is really generational trauma, and bringing back that very first way of meeting that very first impact back to the forefront. So we do have a plan for engaging people with lived experience. We plan to include people with both post-secondary education, ideally a background in Indigenous studies, and then also people who carry old ways, cultural knowledge to come together to create our curriculum to train these people. This should be in practice really for as long as our societies are blended. This should be permanent within Canada and the US. This could be made part of, the regular training and all of these sectors. I know they already do this for adult diversity and quality. So why not add, something that affects all of us as well? Or one more thing that affects all of us. So our prototype does support equality, diversity, inclusion, and decolonization specifically. And cultural safety. This is a huge cultural safety issue in our community right now. And this will support those ideas through just one small step in reconciliation and that entire process. If our prototype is successful, what would change in the system? Hopefully we would have less Indigenous people forced onto medication that is not meant for their bodies, not meant for their minds, not meant for their spirit. And we will also hopefully see a lot less discrimination cases in the healthcare system.